Have you ever heard of sarcoma cancer? If you haven't, this is why it's considered to be the forgotten cancer. I'm Catherine. Welcome to the Inspired Vitality Show, and today I'm giving you a brief overview of sarcoma cancers to bring awareness and understanding. Sarcoma is a rare cancer in adults, only about 1% of all adult cancers, but rather prevalent in children, about 20% of all childhood cancers. Sarcomas are cancers that arise from the cells that hold the body together, or the connective tissues. These connective tissues include cartilage, tendons, fat, muscles, and the bones in the body. There are hundreds of different kinds of sarcomas because they can arise in different connective tissues. The most frequent location are the limbs, since this is where the majority of the body's connective tissues reside. Sarcomas can invade surrounding tissue and can metastasize or spread to other organs of the body, forming secondary tumors. The cells of the secondary tumors are similar to those of primary or original cancer and are referred to as metastatic sarcoma because they are part of the same cancer and not a new disease. Now, there are two categories of sarcomas. There's the soft tissue and the non-soft tissue. The term soft tissue refers to tissues that connect, support, or surround other structures and organs of the body. This is going to include muscles, tendons, fibrous tissues, fat, blood vessels, nerves, and tissues around joints. The many soft tissue sarcomas are grouped together because they share certain microscopic characteristics, they produce similar symptoms, and are generally treated in similar ways. Leiomyosarcoma, or LMS, account for up to 20% of all soft tissue sarcomas. Age is considered a high-risk factor for this particular disease. It can affect people of different ages, but the median age is 58 and a half. Non-soft tissue sarcomas are connective tissue cancers that start in the bone. The most common type of bone cancer is osteosarcoma, which develops in new tissue in growing bones. Another type arises in cartilage. There are some types of non-soft tissue sarcomas that are more prevalent in adults and some types that are more prevalent in children. Although a lot of lumps and bumps we get are benign, if you have a noticeable and unusual lump that isn't going away, bring this to your doctor's attention right away. As with all cancers, early detection is vital to a better outcome, and the only reliable way to determine whether a tumor is benign or malignant is through a surgical biopsy. Treatment for sarcomas depends on the stage of the cancer, and treatment includes surgery, radiation, and chemotherapy. The Sarcoma Foundation of America works to raise awareness, and during Sarcoma Awareness Month, they aim to highlight the challenges that sarcoma patients face and the need for more sarcoma research and better sarcoma therapies. I'm going to link to them, as well as the National LMS Foundation, in the video description. I hope you've gained a little insight into the forgotten cancer with this video and understand the importance of paying attention to any lumps and bumps. See you soon.